So my name is Barbra Fagan, and I work for Chanl Health, and my title is Chief Change Officer. And you might wonder why? Well, it's because technology is challenging for people to embrace. So I feel like our technology, although amazing, we still have to walk through that change process of helping people understand how to use it, its appropriateness, and the clinical outcomes that are fantastic. Absolutely, as we hear day in and day out about security breaches in just regular businesses, and healthcare is sacred, so our software is HIPAA compliant, and we have to go through, I will call them excruciating security assessments, and happy to say we pass them all. I'd say the biggest barrier, and what we do is we deliver technology so that cardiac rehabs can reach and access more patients. So right now, less than 30% of patients who are eligible to attend cardiac rehab actually attend. And there's barriers. I mean, you talk about technology as a barrier. The barriers to attending on-site cardiac rehab is long. Transportation issues, inconvenient class times, high copays. Those are just an example. So what we did at Chanl Health is we created a software platform that allows programs to reach and access patients outside of the bricks and mortar. And so that's pretty exciting. And people are starting to embrace it. I will say COVID, as bad as it was a wonderful introduction for most people into technology. Well, we're still working on it. We know that during the public health emergency, that home-based or remote cardiac rehab virtual sessions that must be real-time, two-way audio-visual are currently reimbursed using a 93797 code, which is a cardiac rehab code without continuous ECG monitoring, through the end of the public health emergency. The 2023 regs just came out for the outpatient prospective payment system, which we asked for virtual direct physician supervision, which means for a hospital such as a critical access hospital that doesn't always have a physician in place, could have, I say the word could have, continued to run their programs by having the physician be available through two-way audiovisual. Those regs just came out last Tuesday, and they did not provide that for us. And so as it stands, virtual supervision of cardiac rehab will go through the end of the calendar year in which the public health emergency ends. Now, fingers crossed, because we have amazing advocacy with AACVPR and Million Hearts and the CDC and AHA, so ACC, and the ship has not sailed, and we will continue to fight. And the thing to also realize is we're talking about the reimbursed sessions. The other part of cardiac rehab that is so effective is our asynchronous. So at Chanl, we created technology that we're delivering asynchronous exercise prescriptions and education. We've partnered with Cardiac College. We've got an interactive education platform. And so oftentimes we get very fixated on is it reimbursed or not. But a lot of what we do in cardiac rehab is non-reimbursable. So I really ask people to consider doing things differently, because maybe you do something that may not be reimbursable now, but it impacts everything else: productivity, staff efficiency, and most importantly, patient outcomes. And AACVPR has a strategy to really look at inclusion and equity in cardiac rehab. It's been something I think we've struggled with for a very long time. And now as you introduce technology and you have what we call cardiac rehab deserts, where patients just can't make that 2-hour drive to a bricks and mortar cardiac rehab. So technology really built around what I would call a hybrid program. So they may come on site one time, have their assessment done, their evaluation, have their exercise prescription, then go back home. and we can connect with them through the technology platforms we have. And the outcomes we're seeing right now for programs that are doing this, we have a group in Montana, they are seeing as good or better outcomes in some of these situations where these patients are completely remote. They come minimally, initial, maybe 30, 60, 90 days, so you can complete that ITP. So it's working, and the way I look at it is some cardiac rehab, although it's maybe a hybrid, it doesn't follow your traditional 36, is better than no cardiac rehab. In terms of equity and inclusion in like technology, what we've found is that most people, even in a lower socioeconomic group, have a smartphone. It's sort of their way to stay connected to the world. And there is a study happening at Henry Ford where they're looking, and now I'm going to forget the name of it, but they are looking at equity in technology. They have one of the lowest socioeconomic communities, and they're still 70 to 80% technology savvy, or have it. Yeah.